Hey, you guys. So, I almost forgot about this. So, I'm not downstairs. My background is going to be what it's going to be. And I'm zoomed in. So, you finna get all this zoomed in today. Um, but I wanted to do this video because this has been a very big question I've been getting a lot from people. So, go ahead and come in, share this video. I'm actually multitasking. I got this video uploaded to YouTube. I am put my glasses on so I could be able to read this stuff and not have to squint. So today what I want us to talk about is not necessarily HIV, but more so talk about AIDS in correlation to opportunistic infections. Hey, you guys. Hey, Tay. Oh, Tay, you should have seen me yesterday. I had my lips on ombre. I was like, oh, I got this for Tay. Look. I was like, I'm going to have to keep watching because the way my basic life is set up, I be trying. I got to post my pictures. I forgot to post them yesterday. But today I want to just talk about the different opportunistic infections. We're going to go in details with each one of them and just kind of really break down what this means for a person when they get an AIDS diagnosis, because this is a question a lot of people have been asking, especially now since Gina 2, she spoke publicly about getting an HIV diagnosis and ultimately ended up having an AIDS diagnosis all in that same moment. And so people watched and saw her go from this, her original size to her going down to, I believe, about 80 pounds or less. And now seeing her kind of get her weight back up, she's being more mobile. She's able to do a lot more independent things for herself. And that is because of her doing everything that I keep telling you guys to do. All right. And so let's just get it kick-started, okay? Yes. Hey, Blazing Doll. So let's just go. We always have to start with that basics. What is AIDS? So AIDS is acquired immunodeficiency syndrome. It's the most severe stage of having the HIV virus. So a lot of times we really don't want to look at HIV in stages, but sometimes when it comes to breaking it down for you all, we really have to look at it in stages, because you have the initial stage of you contracting the HIV virus. You have a stage of, okay, this is the stage where somebody may not start taking medications or they might start taking it. And then that's going to depend on what road they go down once they have the virus. And then you have the stage of, okay, they've chosen not to take the medicine. Now you have the prolonged effects of the virus taking over the body. And now here we are at the stage of them having AIDS. Okay, so people with AIDS have badly damaged immune systems. They can get an increased number of severe illnesses. And those are the ones we call opportunistic infections. So anytime you hear somebody say an OI or opportunistic infections, in correlation to AIDS, these are the things that they're going to be talking about. Now, what are opportunistic infections? These are illnesses that occur more frequently and more severe in people with HIV. This is because they have basically damaged their immune system. They're not taking the antiretroviral medications. They're not going to see the doctor. They're not finding out their viral load. They're not finding out their CD4 count. So they are in turn causing more harm than good. Hey, good morning. Good morning, everyone. Now, today, opportunistic infections are less common in people with HIV because of the effective treatment. But again, like I said, if you don't take the treatment, then you won't see the effectiveness, how effective it is. But some people can still develop these opportunistic infections because they may not know they are HIV positive. They may not be in treatment. or their treatment may not be working properly, meaning the doctor has to go back in and find out something that is going to work for them. How can you prevent opportunistic infections? You first want to talk to your healthcare provider about medications and vaccines that can prevent some of these opportunistic infections. You want to prevent exposure to other sexually transmitted diseases because, yes, other STDs are considered opportunistic infections. You don't want to share needles or syringes or any type of drug using equipment. You want to limit your exposure to germs that can cause you to be very sick. This is going to include things like tuberculosis or germs found in stool, saliva, and other skins, and on skins of animals. So there are some animals that can carry around germs and bacteria that can turn bad for you if it's spread to you. You want to make sure you're not consuming certain foods that can have bad bacteria, like uncooked eggs, raw milk, raw cheese, unpasteurized fruits and juices, and certain raw seed sprouts. A lot of people don't think about these different things, doing some of these things. People like sunny side up eggs. Listen, I don't want none but boiled eggs personally. So, and then you want to make sure you're not drinking water that is untreated. A lot of times when something happens to the water systems, they say, hey, you got a boil water advisory. You don't want to be drinking water that is not safe, especially if it's coming directly from a river or lake. It's not went through filtration. In a lot of foreign countries, you want to avoid drinking tap water. I know grandma used to say, listen, don't come in my house. Go to that water hose outside and get you some water if you're thirsty. I don't know if we want to start doing that in the 21st century, but it is something you want to definitely think about. And you want to always talk to your healthcare provider about things that could expose you to these opportunistic infections, whether it's at work, home, or on a simple vacation. So let's go ahead and dive into these common opportunistic infections. All right, so the first one we are going to talk about, this is going to be Candida. Candida. A lot of people, when you hear Candida, you think about what it is. Candida is basically yeast. It's a yeast infection. That can be a yeast infection, whether it is vaginally or orally. Now, Candida is a fungus, okay? It can affect your skin, your nails. It can affect mucous membranes throughout your body. People who typically are HIV positive and they get Candida or yeast infections, it can happen in the mouth or the vagina. It is only considered an opportunistic infection when it causes severe or persistent infections in the mouth or the vagina, or it develops hold on, wait a minute. I was like, wait a minute, I saw something pop up. Okay. So it's only considered an opportunistic infection if it causes persistent infections in the vagina or the mouth, or when it develops in the esophagus, basically your throat, or your lower respiratory tract, such as your trachea or your bronchial tubes. So the bronchial tubes, so your trach, going into your bronchial tubes that spread into your lungs, the branches of your lungs, basically. So people think yeast infection, I'll just get some over-the-counter, yeast infection medicine and I'll take care of it. Or, if it's yeast in the mouth, that's like thrush in the mouth. I'll just take some medicine. But it can definitely be serious. So Candida, someone said, can I spell it? So Candida is Candida. And if you forget, just look yeast infection. Candida is basically the formal word for a yeast infection, or candidiasis. So I just say Candida, but if you want to get really technical, it's candidiasis. But more formally known as a yeast infection. Another opportunistic infection that is very common is invasive cervical cancer. Now, cervical cancer starts within the cervix, so that's going to be the part on women that is the lower part of the uterus at the top of the vagina. So it is that border between your uterus and once you go into the vagina, okay? This cervical cancer can be prevented, and that's just basically having regular checkups done, making sure you're getting those yearly pap smears, and just not being afraid to allow the doctor to properly assess you. A lot of people feel insecure about their bodies. They're like, I don't want to go have a pap smear done. I don't want the doctor down there. No, get them down there. I don't want them looking down there. They don't care. Let me tell you, you know how much vagina they see as a GYN? They see a lot of it. You think they finna fit here and go in an uproar about your one vagina? They not. But they are going to make sure that if you are having issues down there, that they're going to help you and let you know. So another common opportunistic infection is, I have to look at it, because if I don't look at it, I'm going to say it wrong. So I have to look at it so I can say it right. It's I'm about to butcher it already. It's coccidioid mycosis. I have to look at it. Coccidioid mycosis, and I'm going to spell it for you. Coccidioid mycosis is COCCIDIO DOMYCOSIS. Now this is another fungus. This is sometimes you hear it called valley fever, desert fever, or San Joaquin Valley fever. I think when I heard this for the first time, I heard it is referred to as desert fever. This is when people get this by breathing in fungal spores. Okay, and again, this is only something that is happening if your immune system is compromised and and your body is allowing these opportunistic infections to enter it. This disease is especially common in hot, dry regions in the southwestern United States. So when you think southwestern, think like those southwestern states. So you got Arizona, Southern California, a lot of those desert areas, Utah, those desert areas, those dry areas. So it's very common there. And then it's also very common in South America, because South America is very hot, has a lot of desert areas in South America, and it is very close to the equator. So that is one that is, although it's not common all over, it is common in a very large region of the United States. And then we have cryptococcus. So cryptococcus is, or you might hear it just called crypto. So crypto is a diarrheal disease, and it's caused by a very tiny parasite called Cryptosporidium. So it's this little parasite that can cause you to have symptoms like abdominal cramps and severe chronic watery diarrhea. So again, another thing to look for. This is a telltale sign that a lot of people, this is one of those, now crypto is one that could be considered a sign or symptom of having AIDS, especially for someone who has failed to go and get tested, someone who's failed to get diagnosed and is knowing their status. This is another one that definitely is a sign. If they cannot control their bowels, they're, no matter what they do, it's not being controlled. So this is one that for sure it can be considered a sign or a symptom. Let's see. And then you have cystoid psoriasis. So I told you I have to look at these words because these letters be running together. So cystoid psoriasis, or is also known as isopsoriasis. This is an infection also caused by a parasite. And this enters the body through contaminated water or food. So remember I was saying to you guys that you want to make sure that you are, if you are, what the hell? I'm sorry, y'all. They going around putting stuff on doors. And I'm like, I just saw Carpa. Look, I'm at the window, so I'm looking at stuff too. So you want to make sure that you are not just going around here drinking any kind of water. Symptoms of this can include diarrhea, fever, headache, abdominal pain, vomiting, and weight loss. So that's why I was saying before, you know, you want to make sure you're staying away from contaminated water, because someone who has an AIDS diagnosis or even being HIV positive, this is something that can easily affect your body. Now, CMV is cytomegalovirus. CMV can affect multiple parts of your body and cause things from pneumonia, gastroenteritis, which is basically infection in your colon. Gastroenteritis means your colon is inflamed. Anything that has itis typically means inflammation, okay? Encephalitis, again, inflammation. And that's inflammation of the brain. So anything that has cephalo is dealing with the brain. So that's inflammation of the brain. It can also cause issues with your retina. So it can cause retinitis. It causes your retina, which is in the back of your eyes. It can cause your retina to possibly detach from being inflamed. And people with CMV retinitis have difficulty with vision that worsens over time. CMV retinitis is a medical emergency because it can cause blindness, and if not treated. And I know that Gina too has issues with her eyes. I did not pay attention enough to see if her eye issue was CMV, but this could possibly be one of the issues that she could be dealing with when it comes to her eyes, because I know she was not having eye issues prior to her AIDS diagnosis. And so now having those eye issues could be attributed to her retina having issues. All right. And then I kind of just touched on it a little bit, encephalitis, but more so encephalopathy. So this is more on the HIV related side. So this is a brain disorder that can occur as a part of acute HIV infection and can result from chronic HIV infection. Thank you. Yes, you see I'm repping my Boston Celtics. Its exact cause is unknown, but it's thought to be related to the infection of the brain and the resulting of the inflammation. So basically, encephalopathy is caused from the inflammation that you get from the encephalitis. Then here's one you all probably know. HSV, herpes simplex virus. Herpes, y'all. HSV is a common virus that causes no major problem for people most of the time. HSV, which is herpes simplex virus, is usually acquired sexually or passed on from mother to childbirth. In most people with healthy immune system, HSV is usually latent or inactive. So there are people walking around who don't even know they have HSV because it has not presented itself at any point in their life. Stress, trauma, other infections, or suppression of the immune system, such as HIV, can reactivate those dormant or latent HSV viruses, and symptoms can return. So a lot of people, especially people who are HIV and other STDs, the biggest thing that doctors will tell you is to, they will tell you to stop stressing. Stop stressing. That's why y'all notice, if you've been following me for a while, especially more than a year, if you've noticed, I have started to let less and less things bother me and stress me out. Some stuff you just have to look at it, laugh, and let it roll off of your back like water on a duck. I got this hat from the sports store here local at the mall. So this is an authentic snapback. Authentic snapback. Yep. It is I took my sticker. It had a sticker on it. I don't care about no sticker. I'm wearing my hat. I ain't got time. You know how some people leave their stickers on? Like, why? Take the doggone sticker off. Shoot. All right. So that is another opportunistic infection. That's why I tell a lot of people, when you're HIV positive, yes, you still want to use condoms when you're having sex with your partners, but you also want to get whoever you're going to have sex with, you want to get them tested, because guess what? They could possibly have herpes and not know it. And even though you're having sex with them and using a condom, herpes is not protected always by a condom. Herpes can be in the pubic area. It can be in the groin area, not just on that direct sexual organ. So you cannot always just go by the fact that, hey, I used the condom. Okay. Let's see. Then we have histoplasmosis. So histoplasmosis is another fungus. And a lot of these are funguses because opportunistic infections are like funguses are attracted to any weak immune system. A fungus is like, oh, they weak, let me go get them. So histoplasmosis is a fungus. It most often develops in the lungs and produces symptoms similar to the flu or pneumonia. People with severely damaged immune systems can get a very serious form of this disease called progressive disseminated histoplasmosis. This form of histoplasmosis can last a long time and spread throughout other parts of the body. So histoplasmosis is a very, very serious and dangerous opportunistic infection. And then we have one that a lot of people were introduced to late 70s, early 80s, going into the early 90s, which is Kaposi sarcoma. KS, or you might hear KS lesions, KS sores. So Kaposi sarcoma is caused by a virus called Kaposi sarcoma herpes virus. So KSHV, or human herpes virus. So it has many names, but the easiest way to remember it is just think KS sores, KS lesions, when you associate it with K-parts, if you can't remember all that, basically. So KS causes small blood vessels to grow abnormally and can occur anywhere on the body. So I don't know if you guys ever saw the movie Philadelphia with Tom Hanks and Denzel Washington. So Tom Hanks in that movie was a person who was diagnosed with AIDS. And in that movie, as things progressed, he started getting these sores and lesions over his body. And back in the 70s and 80s and early and 90s, this was one of those signs where people would see these things on people. Like, it prompted a lot of people to just walk around with long sleeves and pants on, because if somebody just saw the simplest thing, like, for example, like I have these little markings on my face. You know, I told you my son kicked me in the chin, you know, or it could have been a bump or a pimple. Somebody would see something like this and they'd be like, sure you ain't got AIDS? Like, that was the thing. Any little marking they would see on your body, they would assume it was one of these KS sores or lesions, and it would prompt them to look at you funny. And so a lot of people were actually discriminated on and shunned because of this. And so because they weren't invisible, like these KS sores appeared pink or purple spots on the skin. Some of them were raised, some of them were flat. And it can be a life-threatening thing. It affects organs inside the body. It affects the lungs, lymph nodes, and the intestines. So it was a very serious opportunistic infection early on in the fight against HIV and AIDS. And then we talked about lymph nodes just now, but lymphoma is another opportunistic infection that refers to basically cancer of the lymph nodes and other lymph nodes tissues in the body. So if you don't know, you have lymph nodes right here at the top of your jawbone, right under your ear. You have lymph nodes here. You have lymph nodes in your armpits. You have lymph nodes in your groin area, right in the bends of your inner thigh. You have lymph nodes. So those lymph nodes, if lymphoma occurs, you can have those areas affected. And then another one that a lot of people are familiar with is tuberculosis. So TB. TB is a bacteria. Mycobacterium tuberculosis is the official name for tuberculosis. It can be spread through the air when a person with tuberculosis coughs, sneezes, or speaks. So that is why a lot of people who get tuberculosis are quarantined. Breathing in the bacteria can lead to infections of the lungs. Symptoms of TB in the lungs can include cough, tiredness, weight loss, fever, and night sweats. So TB is not new. It's been around for a while, and it is very, very still relevant. Hey, you guys. So if you're tuning in right now, we are talking about opportunistic infections, how they are in correlation with someone who's HIV positive and gets an AIDS diagnosis. So I'm just going through a list of different opportunistic infections and breaking them down, telling you guys what they are about. And I'm probably, and my phone just rung. Hey Nana, call Daddy and tell him I'm on live. Call Dad and tell him that I'm on video and I'll be done. I'll call him as soon as I'm done. All right, so the next opportunistic infection I want to talk about is Mycobacterium avium complex, or sometimes it's called MAC, M-A-C. M-A-C is called it's caused by different types of Mycobacterium. So these bacteria live in our environment. So they can be in soil, dust particles, and different types of Mycobacterium are things like Mycobacterium avium, Mycobacterium intracellular, and Mycobacterium contagious. All right, so those are those. And then infections with these bacteria spread through the body and can be life-threatening in people with a weak immune system. So honestly, a lot of these opportunistic infections that I am listing for you guys, these are not just infections that are just directly or specifically for people with an AIDS diagnosis. People who have a weak immune system, so someone that has cancer, someone who has lupus or other types of infections that weaken the immune system. These are all different types of opportunistic infections that they can acquire. Now, some of these are HIV and AIDS specific, but for the most part, a lot of them are very universal to other diseases as well. Next, we're going to talk about pneumocystic pneumonia, PCP pneumonia. So this is not your normal pneumonia. You know, normal pneumonia is just pneumonia. So pneumocystic pneumonia is a lung infection caused by a pneumocystic fungus. And this occurs in people with a weak immune system. The first signs of this infection are usually difficulty breathing, high fevers, and a dry cough. And pneumocystic pneumonia can happen in one or both lungs. I actually remember years ago, I got a phone call about a young lady who was actually in the hospital with PCP. Her family was really trying to get someone to come out to her and talk to her and plead with her to take her medication and to do what she needs to do, because she was in this hospital with PCP pneumonia, could not walk, could not do anything for herself. And I had to go to her bedside and I had to tell her the reality of this. Listen, you don't want this to happen again. When they get you to where you need to be in before you're discharged, when you walk out of this door, you need to understand what you need to do. And I can tell you right now, she has been doing amazing on her journey. Okay? And then here we are to regular pneumonia. So pneumonia. It's an infection in one or both lungs. Many germs, including bacteria, viruses, and fungus, can cause pneumonia. Symptoms include coughing, sometimes with or without mucus, fever, chills, trouble breathing. In people with immune systems severely damaged by HIV, one of the most common and life-threatening causes of pneumonia is an infection with the bacteria Streptococcus pneumonia. So strep. So a lot of people who get strep, if they're HIV positive, a lot of times that strep can get down into the throat and into the lungs and cause pneumonia as well. So people with HIV should get the vaccine to prevent the Streptococcus pneumoniae bacteria. And let's see. So, because I know my doctor, they offer, a lot of times when they say, hey, it's time for your flu vaccine, and they'll also say, hey, you want to go ahead and get a pneumonia vaccine? Like, they'll offer pneumonia, the pneumonia vaccine as well. All right, let's see. Now we are moving on to progressive multifocal leukoencephalopathy. That was a mouthful, right? Progressive multifocal leukoencephalopathy. Now, a lot of these words, being that I was a medical assistant and going into a lot of different fields in the medical arena, I've taken medical terminology classes. And so a lot of people, when they hear these words, they are scared because oh my gosh, this is a big word. What does this mean? So there's a way, and I think one day I'm going to probably sit down and try to do a video where I break down some of these common things that you guys are hearing me talk about. So that way when you hear it, if I say something like leuko means white. So leuko means white. Leuko means white blood cell. So if I say leuko and then N, typically anything N, that N as far as EN means inside. Cephallo, remember I said cephallo means anything dealing with the brain. And then pathy just literally means disease or condition. So when you're looking at a word like leukoencephalopathy, we're talking about white blood cells attacking the brain and causing a disease. That is how that word is broken down. So this is a rare brain and spinal cord disease that is caused by a virus called John Cunningham. It's seen almost exclusively in people whose immune system have been severely damaged by HIV. Symptoms of this can include muscle control loss, paralysis, blindness, speech problems, and an altered mental state. So a lot of times what this can look like is, say, dementia. This can actually look like dementia or sometimes Alzheimer's in people who are HIV positive. And this is one that doctors really try to pay attention to as well, because as you get older, as someone who is diagnosed HIV positive and they progress throughout life with this virus, even though you're doing your medicine and you're taking it the way you're supposed to, it can in some times and in some ways still cause effects on the body over time. And this is one that can definitely rise. Hey John, how are you doing today? And then salmonella bacteria. We know what this is. We gotta always make sure we cooking our food right. Make sure we're not drinking contaminated water, because that is how this salmonella virus gets into the body, from drinking or eating something contaminated with it. Salmonella can affect anyone and usually causes nausea, vomiting, and diarrhea. Listen, food poisoning at its finest, ladies and gentlemen. Been there, done that. And if you guys know anything about my last 2 situations of food poisoning, it was no fun. The first time it sent me to the emergency room needing IV fluids. So yeah. And then we have toxoplasmosis. So toxoplasmosis, if you guys have pets and specifically cats, you're familiar with toxoplasmosis. This is also something that they tell people to make sure. It's a reason why they want them to stay away from cats when they're pregnant. So this is an infection caused by a parasite. The parasite is carried by warm-blooded animals such as cats, rodents, and birds. And it's released in their feces. That's why they said you pregnant, don't change no cat stool. All right. People can develop things by inhaling the dust or eating food contaminated by this parasite. Toxoplasma can also occur in commercial meats like red meats and pork, but rarely in poultry. So you eat some chicken, you know, it might be good. You eat some steak and some pork, you got a higher chance of getting salmonella, toxoplasmosis. Infections can occur in the lungs, the retinas of the eye, heart, pancreas, liver, colon, testes, and the brain. Although cats can transmit toxoplasmosis through their litter boxes being changed, as long as you're doing it safely, say gloving up, wearing gloves, washing your hands thoroughly, that is a good way to prevent that from happening. All red meats that have not been frozen for at least 24 hours should be cooked through to an internal temperature of 150 degrees. Because if not, you're going to be sick, honey. You're going to be sick. Okay? All right. And the last opportunistic infection we are going to talk about for today, and we're going to be done, is going to be wasting syndrome due to HIV. So wasting syndrome is defined as the involuntary loss of more than 10% of one's body weight while having experienced diarrhea or weakness and fever for more than 30 days. Wasting refers to the loss of muscle mass, although part of the weight loss may also be due to a loss of fat. So this is one of those things that a lot of people used to say, oh, if this person, oh, you just lost all that weight, you must got AIDS. Like, this was a thing back in the 70s, 80s, and 90s. If somebody was, say, 160 pounds and all of a sudden now they're down to 130, you know, and then it happened in a very short time span, a lot of people was like, you lost weight fast. What's wrong with you? You sick? Like, that was a thing. And so people would assume because someone had something like that, that it was attributed to them having AIDS or HIV. Now we know in the 21st century, that ain't always true, because somebody could go one day and get a gastric bypass, a sleeve done, and within a couple weeks, they done lost some weight. So you can't always just say because somebody lost weight, this is why. But it is and has been one of the opportunistic infection things that can happen to someone when they have HIV or AIDS. All right, you guys. So I hope that if you were tuned in and listening, whether you came in at the beginning, middle, or here at the end and have to go back and watch the replay, I hope that you were able to get some type of information and education from this video. Thank you guys, everyone, anyone who sent stars. I appreciate you greatly. Thank you so much. If you shared this video, thank you. I appreciate you. And I am going to be out of here, you guys. I'm getting ready to go and record an interview. And I will talk to you guys later. Bye.